Meet Gail. Back pain was interfering with her daily life.
The back pain was in the lower back. It manifested by total numbness in my right foot, eventually evolved to the point where there was shooting pains from the lower back all the way down the leg in different spots. Sometimes the numbness in the foot would go away, and other times it was just there constantly. I think it was the radiating pain from the back down my right leg that said, I really need to go do something, coupled with the fact that it was waking me up at night multiple times during the night, so I wasn't getting the rest I needed at night. And it was that was really pushing me to the point that, something had to be done, and I didn't want to go the traditional therapy method. I knew that traditional therapies are, number one, expensive, number two, do not really fix the problem. I had seen that firsthand. Traditional to me is pain management whereby it's cortisone shots, it's medication. I'm medication adverse because I've seen personally what it does to the quality of a person's life, and I really didn't want to go that route. I had done a lot of research 5-10 years ago on regenerative medicine, and I did it on behalf of trying to find a solution for my husband at that point in time, who has experienced significant back issues through his life. And lo and behold, did I know that I would encounter some of the same back issues. As a result of it, I ramped up some research on trying to find somebody locally.
Gail's search landed her here, the Supreme Center of Excellence in Pain and Regenerative Medicine. She met with Dr. Roshni Patel.
First of all, she is such an amazing person. She's so energetic, she's so warm. She is an amazing listener. I came in with a fire hose of questions because of all the research I've done through the years. And she was able to fire back with all the responses or acknowledgement of what I had read relative to what I thought was happening. And she spent a lot of time, and I will say my history of interactions with doctors is nothing compared to what Dr. Patel provides.
Gail received an injection of PRP, or plasma-rich protein. Dr. Patel specializes in this type of regenerative medicine. She uses a patient's own blood, spins it down to get the PRP serum, and injects it into the areas of pain. Using this method, essentially, a patient's own body is healing itself.
I kind of equate it to, if you've ever had acupuncture, it feels kind of like that relative to the needles that go in your back. So it's not painful. You can feel it, but it's not painful. It's over in a relatively short period of time, and you walk out, and then you let your body do the healing from there.
Within weeks, all of Gail's pain faded away.
So this is the difference between traditional versus PRP. Traditional, you get an immediate effect within probably a week. With PRP, it's a gradual, effect. So it probably took, I want to say about 8 weeks, but you could feel things starting to fade away. The numbness in the foot, the radiation of the leg. And then I continued to do follow-up appointments with Dr. Patel, and we would go over things and ask her additional questions, and she would be able to respond back to me. And I would describe, but I'm still feeling this like V-shaped pattern. And she'd be able to articulate what was going on. She said, but it'll go away. And sure enough, it went away. And, going from like a pain level of 9, 10 down to 0 is an amazing process to watch. I feel great. I came in with pain, and it's eventually gone away. I know I have a little bit of insight that a lot of her patients have called her the miracle worker. And, I believe not only is she a miracle worker because she can diagnose and apply the treatment appropriately, but the therapy in itself is a miracle. And it's just wonderful to see that you can use parts of your own body as a healing agent in the therapy. Quality of life is great. I don't get disrupted in sleep, and that is huge for me. I don't feel it during the day. I just don't have pain, so I don't even think about it. I just go, about my daily life. Like, I want to go, and I want to be able to age up and enjoy life and do things. And when I'm not working anymore, go play tennis. Get back into the athletic type of events that I like to engage in. Regenerative medicine, from my point of view, is the best therapy to address the pain issues that are occurring in the spine. It has made a tremendous difference in my life, and I would recommend it to anybody. Get in early, address your pain, and remove some of the quality life issues and the misery you may be experiencing.
The Supreme Center of Excellence in Pain and Regenerative Medicine